Want to pass your Hesi Fundamentals exam? Then let's get started. Today we'll cover 10 questions based on biophysical nursing, a heavily tested subject area in your Hesi Fundamentals exam. Question 1. Which of the following best describes the primary function of the cardiovascular system? Regulation of body temperature, transportation of nutrients, gases, and waste products, protection against pathogens, hormone production. Pause the video and select your answer. If you chose option B, you are correct. Transportation of nutrients, gases, and waste products. The cardiovascular system primary function is to transport blood throughout the body. This includes the delivery of oxygen and nutrients to tissues and the removal of carbon dioxide and waste products. Question 2. Which electrolyte imbalance is most likely to cause cardiac arrhythmias? Hypercalcemia, hypokalemia, hypernatremia, hypomagnesemia. Pause the video and select your answer. If you chose option B, you are correct. Hypokalemia. Hypokalemia, which is low potassium levels, can lead to cardiac arrhythmias because potassium is crucial for normal electrical activity of the heart. Question 3. The nurse is assessing a patient with respiratory acidosis. Which condition might have contributed to the development of this acid base imbalance? Prolonged vomiting, hyperventilation, chronic obstructive pulmonary disease, diabetic ketoacidosis. Pause the video and select your answer. If you chose option C, you are correct. Chronic obstructive pulmonary disease. Respiratory acidosis occurs when the lungs cannot remove enough carbon dioxide, leading to increased blood acidity. COPD is a common cause due to impaired lung function. Question 4. Which of the following is a common symptom of fluid volume excess or hypervolemia? Tachycardia, hypotension, weight loss, edema. Pause the video and select your answer. If you chose option D, you are correct. Edema. Fluid volume excess often leads to edema, which is the accumulation of excess fluid in the tissues causing swelling. Question 5. What is the primary role of insulin in glucose metabolism? Increasing blood glucose levels, facilitating the transport of glucose into cells, promoting the breakdown of glycogen, stimulating the production of glucagon. Pause the video and select your answer. If you chose option B, you are correct, facilitating the transport of glucose into cells. Insulin helps cells take in glucose from the blood, thereby lowering blood glucose levels and providing cells with energy. Question 6. A patient with a serum sodium level of 125 is experiencing hyponatremia. Which of the following symptoms is associated with this condition? Confusion, hypertension, bradycardia, hyperactivity. Pause the video and select your answer. If you chose option A, you were correct. Confusion. Hyponatremia, which is low sodium levels, can cause confusion, headaches, nausea, and in severe cases, seizures and coma due to its effects on the brain. Question 7. What is the normal range for arterial blood pH in a healthy adult? 7.35 to 7.45, 7.25 to 7.35, 7.45 to 7.55, 7.15 to 7.25. Pause the video and select your answer. If you chose option A, you are correct. 7.35 to 7.45. The normal pH range for arterial blood is 7.35 to 7.45, maintaining a slightly alkaline environment necessary for physiological processes. Question 8. Which hormone is primarily responsible for regulating calcium levels in the blood? Thyroxine, insulin, parathyroid hormone, cortisol. Pause the video and select your answer. If you chose option C, you are correct. Parathyroid hormone. Parathyroid hormone regulates calcium levels in the blood by increasing calcium absorption in the intestines, releasing calcium from bones, and reducing calcium excretion in the urine. Question 9. A patient is receiving an intravenous infusion of potassium chloride. The nurse should monitor for which potential complication: hypokalemia, hyponatremia, hyperkalemia, hypercalcemia. Pause the video and select your answer. If you chose option C, you were correct: hyperkalemia. Infusing potassium chloride can increase potassium levels in the blood, potentially leading to hyperkalemia, which can cause dangerous cardiac arrhythmias. Question 10. Which type of cellular adaptation involves an increase in the number of cells in a tissue or organ? Hypertrophy, hyperplasia, atrophy, dysplasia. Pause the video and select your answer. If you chose option B, you are correct: hyperplasia. Hyperplasia is the increase in the number of cells in a tissue or organ, often as a response to a stimulus. Click that subscribe button and join us next Friday.